Good afternoon. My name is Dr. Petrikovsky. I'm a professor of obstetrics and gynecology. And in this short video, I'll talk about coronavirus and how it affects human heart. This talk is based on the recently published manuscript in JAMA Cardiology. As I mentioned before, in my talks, I use mostly and predominantly peer-reviewed publications. Now, the question is why we didn't talk about coronavirus and human heart earlier is because as this pandemic evolves, we'll learn more and more about it. The most prominent epidemiologist, Dr. Fauci, relatively recently made a statement that coronavirus is not something the American public needs to worry about and be frightened about. Was he wrong? The answer is no, because nobody has a crystal ball. As the disease evolves, we get more and more knowledge about it. The disturbing fact is that, at least in New York, and I'm sure in many other places, the cause of death from coronavirus is not only acute respiratory deficiency, but also the cardiac condition. This particular paper refers to the autopsy results on the patient who succumbed to coronavirus, and they found inflammatory changes in the human heart. The interesting thing is that coronavirus affects human heart on both sides. First of all, it's a direct damage brought by the virus, inflammation, fever, and oxygen deficiency to the human heart. That's how the virus affects the heart on one end. On the other end is our body's response to coronavirus. And what we see very often is what we call cytokine storm. Coronavirus causes release of a lot of active substances that indirectly or directly affects the heart. So therefore, we see increased incidence of cardiac failure, so-called heart attacks, which are not classic, related to coronavirus. On the scientific standpoint, it's important that so-called angiotensin converting enzyme 2, ACE2, is the way coronavirus enters the cell, because the receptor has a strong binding affinity to the spike protein of coronavirus. A human heart has a large amount of those receptors. So heart is one, except for lungs and respiratory system, heart remains the target organ for coronavirus. For the patients with pre-existing condition, according to the current recommendation, it's very important to keep taking the medication for both hypertension and cardiac problems in spite of coronavirus. So it's very important to keep that in mind. Thank you and stay safe.